I'm Farzana Hussain. I'm a GP and I work in the project surgery, which is in Plaistow in Newham. I'm a single-handed GP and I work part-time, although being single-handed, it's never quite part-time. I'm also a mum of two. I have a list size of just over 4,000 patients and I work in an area which is one of the most deprived areas of the country, which brings its own challenges. Ever since I went to medical school, I wanted to enter general practice. I wanted to help people and save lives. And in the sad times when we can't save lives, I wanted to comfort people. I really wanted to make these video diaries to share my quality improvement journey. I've learned so many things that are seemingly simple yet so powerful, and I use them every day. Talking to friends and colleagues, I realised that they feel quite isolated, and I think that if we could share even one or two of the tips, that we could make a difference, not just to the patients in my surgery, but to the patients over the country. In November 2013, a tragedy hit the practice. I was part of a two-partner practice and had been working in the surgery since it opened in 2003. My partner and best friend, Peter, actually committed suicide in November 2013. This left me as a single-handed partner, and I very much wanted to carry on all the great work and the quality work that Peter had aspired to. I worried about whether I would be able to do this, as I had two young children who were aged 9 and 10 at the time. And I was really looking for something to make sure that I could carry on the work and improve the work that I was doing with my patients to improve their health and the morale of the staff that I worked with. I went on the General Practice Improvement Leaders Programme and I was introduced to a model called the Change Model. Its simplicity is fantastic, and one of the elements of that is leadership by all. It really changed the way I worked. Up until then, I had been quite bogged down with wanting to do everything myself. I came back to the practice and I started working more closely with my healthcare assistant. Previously, patients who had high blood pressure had a 10-minute consultation with the GPs, who would measure their blood pressure and then make appropriate management decisions and prescribe. After the course, I decided that actually leadership was something that everybody could partake in, and now the healthcare assistant sees the patients who have blood pressure and does a consultation with them, and then I have a 2 to 3 minute telephone consultation with my healthcare assistant just to do the prescribing and the management, and then she can tell the patient the decisions I've made. This has reduced GP workload and has freed up access for patients. My healthcare assistant's also loving it because it's given her more autonomy and it's made our team far more cohesive. So we're currently in the middle of summer and we have a lot of hay fever sufferers asking for GP appointments. I learnt about the Plan, Do, Study, Act cycle, and we planned what we were going to do as a team. I was very nervous about asking receptionists to signpost patients to our local pharmacists, who can also treat patients for hay fever. I wondered if the patient would still insist that they wanted to speak to their GP. But as we planned it and we spoke together as a team, I realised that reception were really on board to signpost patients and didn't think it would be a problem. Having then moved on to the study element, we found that it was working really well, and now we barely see any patients with hay fever, and this has freed up about 10% of our GP consultation time.